I chose to become a nurse practitioner because after having worked as a registered nurse for a long time, I wanted to be involved more with patient assessment and making decisions in the care for the patient.
I love the flexibility that I have. I love being able to have that nursing component that I feel brings a special touch to the patient care.
So you do write orders, you can assess the patient and make decisions as far as like what medications, what type of treatment they should have, and you can have a lot of impact in bettering patient care.
I think the negative component would be the pay. At this point in time is not as competitive as PAs or physicians. I mean, it's pretty much almost as a registered nurse. So you take a lot more risk, but the pay is pretty much the same.
Being a nurse practitioner takes a lot of training, of course. And when you come out of high school, you'll do your 4 years of your undergraduate that ends up being your bachelor's of nursing.
And then you have to go on to obtain your master's, which is another 3 years, and along the way you get your nurse practitioner as well. And at this point in time, our understanding is by 2014-15, we all have to be doctorally prepared. So that could take another 2 to 4 years depending on the university that you're going to as well. So it takes almost a total of almost 8 to 9 years to obtain your NP at the doctorate level at this point in time.
People that make good nurse practitioners are caring and love to be around people. They have good communication.
I feel personally, in order to be a nurse, period, you have to have empathy. Any job that you do, I believe you should go in as a sense of service and you get a lot more out of it, no matter what your profession is.
There is so much the nurse practitioner offers. You could be totally administration, 100%. There's also the ability just to teach at the nurse practitioner level. And aside from all that, you could specialize. You could be a family nurse practitioner and go into the urgent care. You could go into the emergency room. You could go into the hospital and be hospital-based, or you could be outpatient clinic-based.
That's one of the wonderful things about being a nurse practitioner. There's pretty much whatever you want to do, you can do that. And overall, you can impact society, leading them into wellness and making this world a better place, one patient at a time.